Hello, my name is Allison, and myself and my partners Anna and Sarah will be talking about psychedelics today. We will address 3 different types of psychedelics. First, I will talk about hallucinogenic mushrooms, and then we will cover DMT and LSD. So to start with the history of mushrooms, the earliest reviews of the use of hallucinogenic mushrooms was recorded by Schultz in 1939, Heim in 1956, and Wasson in 1957 in Mexico. Amanita muscaria is believed to be the oldest hallucinogenic mushroom used by humans. LSD is made from ergot fungus, also known as Claviceps purpurea. Mushrooms have historically been used recreationally and for religious practices. However, in the 1970s, prohibition of hallucinogenic drugs in the United States caused a decrease in its use and availability. To talk a bit about the effects and current uses, using hallucinogenic mushrooms generally can cause changes in visual and auditory experiences. They may create a feeling of an altered state of mind. Also, possible symptoms of nausea and negative headspace may occur. Mushrooms contain psilocybin and psilocin, and the conversion of psilocybin into psilocin once the mushrooms are ingested produces the psychedelic effects. Historically, use of mushrooms and other psychedelic drugs have been prohibited in the United States. Despite being illegal, though, many individuals have continued to take psychedelics recreationally. While mushrooms and other hallucinogenic drugs were largely criminalized following the 70s, currently some cities and states are actually decriminalizing psychedelic drugs. Willingness to decriminalize psychedelics in these cities and states is largely due to the U.S. Food and Drug Administration becoming interested in researching these drugs for therapeutic purposes, especially in cases of treatment-resistant depression. To draw some conclusions about mushrooms, due to their psychedelic properties and lack of support for medical and therapeutic use, mushrooms are still illegal in the United States today. Despite being criminalized, the use of psychedelic mushrooms for therapeutic purposes is being explored in some states, leading to a possibility of decriminalization. The benefits of responsible use in cases of treatment-resistant depression, substance use disorders, and PTSD have shown support for potential benefits of medical mushroom use outweighing some of the risks. While irresponsible recreational use of psychedelic mushrooms may lead to undesirable outcomes, microdosing may actually avoid such outcomes while achieving desirable benefits. Microdosing refers to taking a dose of a psychedelic substance that is too small to produce the hallucinogenic effects. Potential benefits of microdosing may include improved mood overall, also increased ability to focus, enhanced creativity, and improved sociability. So now I will hand over the presentation and we will talk a bit about DMT.
So moving on to N-dimethyltryptamine, or DMT, it is an endogenous hallucinogenic that can be found naturally in many plants and animals, such as the Psychotria and mimosa plants, and as well as in certain toads and even sea sponges. DMT can also be produced synthetically, where it's best known for producing brief, intense psychedelic effects. So, getting into the history of DMT, it was first synthesized in 1931 by Richard Monsk, and its natural occurrence in plants was discovered in 1946 by Oswaldo Gonçalves. And its hallucinogenic properties were discovered in 1956 when Steven Cesara extracted DMT from a plant and injected it into himself. However, DMT has been used for hundreds of years in South America for rituals and healing purposes. It became popular in Western culture in the 1960s and was put under federal control with the Controlled Substances Act in 1971, where it's still illegal today. Looking into the effects and current uses of DMT, it is typically smoked or brewed and used either recreationally or in spiritual rituals like ayahuasca. So DMT is one of the components to the ayahuasca blend, so it's most commonly used for its psychoactive effects. It has no current approved medical use in the U.S. However, current research shows promising evidence for DMT as a possible tool for treatment of anxiety and psychosis. So the onset of effects happens nearly instantly and lasts for about 30 to 45 minutes, where some of the psychological effects include intense visual hallucinations, depersonalizations, auditory distortion, and an altered sense of time and body. Many people describe the experience to feel like dying or feeling like they're being possessed by aliens, and it's very common to experience the altered sense of time and body, especially. Many people experience their trip to be much longer than it actually is, so people have come out feeling like they've lived an entire lifetime within their DMT trip, so it can be very intense. And it appears to have limited neurotoxicity and other adverse effects. However, frequent use and abuse can lead to psychosis, mood disorders, and ongoing paranoia. In conclusion, there's increasing evidence suggesting that DMT could play an important role in the central nervous system and may act as a neurotransmitter, as well as having possible therapeutic significance in the development of certain therapies where it's been proposed to treat anxiety, substance abuse, or even cancer. So I think there's definitely a lot more research to be done. I think it is really interesting that this could be a possible treatment for these certain mental disorders, but based on the intensity of the drug and the effects, I think it's not something to be messed around with, and there definitely should be more research to further these ideas. So next, we're going to be talking about LSD.
Okay, so LSD, or lysergic acid diethylamide, was first synthesized in 1938 from ergot, which is a fungus found in tainted rye, and it was first consumed accidentally by Swiss chemist Albert Hofmann in 1943 in his lab. And it was used recreationally and became popular during the hippie movement in the 1960s, but then psychedelics became classified as an illegal Scheduled 1 controlled substance. So how LSD works is actually a complex mechanism of action, and like all psychedelics, LSD alters perception and mood and causes hallucinations, which are known as trips or tripping on acid. And the vivid and complex hallucinations can be explained by LSD increasing connectivity in the visual cortex, which is a network that is normally more dissociated. And it is an extremely potent drug, and it affects dopamine receptors, adrenergic receptors, glutamate receptors, and most importantly, it's a partial agonist at 5-HT2A serotonin receptors, and this is also where the most research has been done. And so LSD binds to serotonin receptors at a weird angle, causing the receptor to fold over the LSD, creating a lid and trapping it. And this method of trapping causes the receptor to continually fire, which results in hallucinations. And this little graphic is like a crystallized LSD binding to serotonin receptors. And so the body's response to this takes 12 plus hours, which is why the high lasts for so long. So the current uses so far are microdosing, and it was found that microdosing LSD may have potential therapeutic properties for mental health disorders like depression, anxiety, or anxiety associated with life-threatening illnesses. And in a study with patients who were suffering from anxiety associated with life-threatening illnesses like cancer, it was found that they felt a significant decrease in anxiety and an increase in quality of life 12 months after microdosing with LSD. And the way microdosing works is that it attempts to skip the hallucination aspect of LSD in hopes of increasing energy, creativity, and alertness. And in another study, 2 weeks after microdosing, healthy patients noticed they felt more optimistic, open, and close to others. And also, microdosing may be used to reduce pain, cluster headaches, and migraines. But of course, there's a lack of data and scientific studies done on microdosing, which is why it's not currently accepted as a normal practice. So for conclusions, when taken recreationally and at high doses, LSD alters the state of mind and produces powerful and vivid hallucinations. And this, of course, can result in bad trips, which can lead to paranoia and panic attacks. And this can also result in flashbacks, which is experiencing the high all over again months after the drug is worn off. And in rare cases, significant flashbacks can happen, which is known as hallucinogen persistent perception disorder, or HPPD. And it's basically a never-ending trip. But I think that microdosing in a medically controlled environment has potential therapeutic benefits, and it was found that it's not addictive. And although you can't say psychedelics are safe, but they are definitely less dangerous than cocaine or heroin. And also, it was found that LSD does not increase the risk of psychosis, depression, anxiety disorders, and suicide attempts, which is just more support for why I think there should be more research on microdosing of LSD for future uses. So thank you for listening to our presentation, and here are all the references we used in our project.